Chicago's Christmas decorations may be in place, but the focus for the city and for the US state of Illinois is elsewhere. A rapid resurgence in COVID-19 positive infections has led Illinois Governor J.B. Pritzker to once again order tighter restrictions. Museums, casinos and theaters must close, while retail stores must adhere to new capacity limits.
Remember, the core philosophy here is that if we all stay home as much as possible, if we all avoid the trips outside the house that we don't need to take right now, we can fight this recent surge and turn things around for our healthcare workers and hospital systems.
Scott Friedland is the owner of Timeless Toys, a small specialty toy shop in the Chicago suburbs. Following the first lockdown, the shop strengthened its online store, offered curbside pickup, as well as free deliveries in the area. But the new restrictions promise a further strain on the business at a key time of the year.
We're here to find what the right toy is for your child and not necessarily what the most popular thing is. So we want to talk to you about your kid, get to know them, and find the perfect toy for them. That gets lost a little bit in online sales. You don't necessarily have that experience.
How y'all doing today?
Signs of the economic impact of COVID-19 in the Chicago area are easy to see. For months, long lines have formed at food pantries.
The pressure on small businesses in Chicago and much of the rest of the US looks set to continue for the next few months as more restrictive lockdown measures are imposed. But the grim reality remains. Hospitals and medical facilities are simply struggling to cope with a huge surge of COVID-19 cases.
Illinois has again expanded its testing capacity. The state is reporting record positive cases and hospitalizations. The death count is also rising quickly.
The really concerning thing is that we're in this second surge and we've not yet shown signs that this surge is slowing down. And now, as we know comes along after that, we've seen rises in hospitalizations and ICUs and even deaths, all of which are up 3 times what they were.
There is now a real fear that hospitals could get overrun, and that includes the new Roseland Hospital on the far south side of Chicago.
We're not going to have the staff, we're not going to have the doctors, and we're not going to have the beds unless we do something to dampen this. We're seeing staff members in beds next to patients right now. Our doctors are going to be dying next to our patients if people don't slow this spread.
News of successful trials for COVID-19 vaccines offer hope, but their widespread distribution is still some time away. In the meantime, for officials here, difficult decisions lie ahead. Dan Williams, CGTN, Chicago.